And new from the state capitol newsroom, the battle over COVID misinformation is now heating up.
The Tennessee Board of Medical Examiners is reviewing a September notice to physicians. It notifies them that COVID-19 misinformation could lead to disciplinary actions.
Gerald Harris is live outside of the meeting with new information tonight. Gerald.
Yeah, and under that September guidance, doctors who generate or spread COVID-19 misinformation are risking their suspension of their license.
The state medical board says physicians have an ethical and professional responsibility to practice medicine in the best interests of their patients and must share information that is factual, scientifically grounded, and consensus-driven for the betterment of public health.
I think it's very important that as physicians we're held to a high standard because what we do matters, especially during a pandemic.
While some doctors agree with the stand against medical misinformation, leading Tennessee politicians do not. During October's special session on COVID, GOP lawmakers led a ban against disciplining doctors who prescribe, recommend, or use treatments not approved for COVID-19.
When you insert politics into science and medicine, you are slowing down progress, and bureaucracy is a big machine that moves at a very slow pace.
Special rules regarding COVID policies from the medical board must now be approved by the General Assembly.
They need to give us the right information and what these medicines consist of, because people are dying over COVID, and if they give us misinformation, then who knows what can happen.
Doctors say this comes down to trust.
We need to be able to ensure that our profession is trusted and that the information that we're providing the public is accurate.
Physicians are also asking the board to take their oath and the oath of doctors across the state to do no harm seriously.
There are going to be outliers out there. There will be physicians who will say things that go against the grain. What I would tell people is when you have the vast majority of doctors and scientists and public health officials telling you that vaccines are safe and effective and that ivermectin does not work to treat a virus, listen to the majority.
And new tonight, from GOP pressure, the board, just voted to take down that statement from their website. Reporting in Nashville, Gerald Harris, News 2.